What comes to your mind when you hear the word chemotherapy? I guess some people don't even know what chemotherapy is. I'm going to tell you. Chemotherapy is one of the treatments used in treating cancer. And then when you tell a patient that they need chemotherapy, studies have shown that about 1 in 10 patients refuse it, they decline it, or they run away. And that's why this video is here to debunk some myths or misconceptions about chemotherapy. Because we found out that most patients make their decisions based on what they see other people or they hear from other people about chemotherapy. So don't go anywhere, stick with me. Number one, some people think having chemotherapy will make the person lose all their hair. I'm here to say that's not true. Not all chemotherapy can make one lose all their hair. Some chemotherapy will even keep the hair. There will be no change to the hair. While some others will just be only part of the hair. It's just going to thin the hair down. It's not going to make the person lose all the hair. And another thing is that there's an option called the cold cap or the scalp cooling. This scalp cooling makes sure that the hair is frozen and preserves most of the hair, about 80% of the hair, while the patient is having chemotherapy. Amazing, isn't it? And then number two, some people think chemotherapy is painful. Chemotherapy is given in a bag, the same way you have your drip or your IV drip. That's the same way chemotherapy, most of the chemotherapies are given. They're given in a bag of fluids and through the cannula, through a PICC line, or through a port. So most of the times the patient doesn't feel anything. Chemotherapy can go over 30 minutes, over an hour, 3 hours, or even for some days through a chemotherapy pump. And then number three, some people say that people who take chemotherapy look very sick or are going to be very sick. No, that's not true. Most patients who have chemotherapy are also given anti-sickness medications that are very effective. So the patient may not necessarily suffer from sickness. Another thing people talk about chemotherapy is that if a patient is having chemotherapy, then the patient should be isolated from the family, their friends, or the usual activities. Not true. If you're having chemotherapy, even though we tell you, okay, be very conscious because of the risks of infection, it doesn't mean that you cannot mix up with your friends and family. It only makes you to be cautious, but not being isolated. So you can enjoy your life, you can do the things you want to do, but you just have it at the back of your mind that you're having chemotherapy. Another misconception is that patients who are having chemotherapy should be on a special diet. Not true. If a patient is having chemotherapy, we only advise that the patient should have balanced diet with a little bit of more vegetables and fruits, and it should be done in a hygienic way. But it doesn't mean you cannot enjoy your normal, yummy food. Number 5 misconception is that people who receive chemotherapy are patients who are terminally ill or who have no hope or who are close to dying and all of that. That's not true. Chemotherapy can be given for so many reasons. Chemotherapy can be given early in the cancer to cure the cancer. It can be given before surgery. It can be given after surgery. It can be given to control a disease, a cancer disease that is spreading so quickly. And lastly, it can be given for palliative reasons. If the patient is complaining of pain, if the patient is having bleeding, if the patient is not having a good quality of life, chemotherapy can be given. So it's not for those who are dying. It can be given for so many reasons. Lastly, some people think that the same chemotherapy is given for all cancer patients. Or some people think that patients with breast cancer, for example, receive the same kind of chemotherapy. That's not true. Chemotherapy is given on an individual basis. Different chemotherapy for different patients because they have to look at the type of cancer, the stage of the cancer, the way at which it is spreading, the patient, how the patient looks like. There's so many things that are considered before deciding which chemotherapy is suitable for which patient. And then you look at the age as well. We understand that chemotherapy can be scary at times, but having the right information and support can make the journey a little easier. And that's why we're here to help you. So help us to make this video reach more people by liking, by sharing, and by commenting. Hope to see you next time. Bye.